between the two now.
Okay, fair enough. Yes.
Can I add to that?
Sure.
The one thing that BPH will do, though, is it raises your PSA level. So just because you have BPH, you're more likely to get a prostate biopsy. The most important risk factor for prostate cancer is having a prostate biopsy. So if you have BPH, you're more likely to be diagnosed with prostate cancer just because of a numbers game. If you get a biopsy, you're more likely to get diagnosed.
Not because a biopsy causes the cancer.
Correct.
It's because if you look, you find.
Correct. If you look at autopsy studies that have been done, it's probably about 40 or 50% of men over the age of 50, if you really look at their prostates carefully, have some prostate cancer in them. So if you do enough biopsies on enough men over the age of 50, you're going to find a lot of prostate cancer. Death rate from prostate cancer is about 3.5%. So there's a huge difference between seeing it under the microscope and ultimately dying of prostate cancer. And that's the whole thing about risk assessment. Not everyone that's diagnosed needs to undergo a therapy. And the man needs to know that before he gets the biopsy. That's the time to start discussing about active surveillance and things like that is not after you've been diagnosed with prostate cancer. It's before you actually opt to have a biopsy.
I want to get back to something about biopsy in just a second, but since we were talking about